Good afternoon or morning, everyone, and welcome to this webinar. Thank you for joining today's Community Engagement Alliance Community-Based Organization Community of Practice peer-to-peer session. This session is held in collaboration with the Community Engagement Technical Assistance Center, or CETAC, and will focus on community-centered research communication, highlighting strategies from community-based organizations, community partners, and their academic research partners. I am Busola Saka, and I am on the CETAC communications team. We do a lot of promotion of our research team's work and also provide general universal technical assistance on different communications topics. So in today's webinar, we are going to introduce the CEAL CBO COP. Then we'll hear from CEAL teams on community-centered communication strategies. We will also learn about a dissemination toolkit by CEACR, and we will explore available communications technical assistance resources. Okay. So the goals for this webinar are to understand how CEAL CBOs and researchers effectively involve their communities in research through communication. We will learn how they measure communication success, and they will also share best practices and opportunities for outreach and returning results. I will now turn it over to Adelaide and Donnie to introduce themselves and talk a little bit about the CEAL CBO COP. And we'll start with Adelaide. Go ahead.
Awesome. Thank you so much, Busola. So happy to be here in this collaborative space. And so as we start, hello and thank you everyone for joining us. I am Adelaide Holloway, a senior community health worker from the Sinai Urban Health Institute of Sinai, Chicago, as one of the collaborating partners of the Illinois CEAL Region's Chicagoland CEAL program, and as one of the co-leads of the CEAL community-based organizations, community of practice. I would love to ground everyone in this partnership with sharing our aims of the CO, CBO, COP, in which, right, we aim to deepen the partnerships between researchers and community-based organizations with efforts led by community health workers, such as myself and Donnie, and CBOs partnering with CEAL to create a collection of community experts that fosters mutual trust, collaborative learning, and community-centered public health strategies, especially in communities most impacted by health differences. And so with that, I will pass it over to my partner in progress, Donald, as the other co-lead.
Thank you, Adelaide, and to everyone. Good afternoon, good morning. For descriptive purposes, my name is Donald Young. I'm co-lead of the community-based organization, Community of Practice. For descriptive purposes, for those who may be visually impaired, I'm African-American. I am bald-headed. I wear a beard, and I have on eyeglasses. I have on a brown sport coat and a gray wide T-shirt underneath. And it is awesome to be here. It is awesome to be in this space and co-lead with Adelaide. The goals of the CEAL CBO COP, I came to this group by way of the CEAL DMV group out of Johns Hopkins Institute for Clinical and Translational Research, where I worked as a lead community health worker that led data collection and some evaluation of CEAL program. I worked with the now sunsetting HKMRS, which was a great opportunity. The goals of this CEAL CBO COP is to strengthen the partnerships between community-based organizations, community health workers, and research entities. We hope to build a sustainable network of community leaders to address health challenges, and we move to support community health workers engagement by recognizing and partnering with their insights and strong community ties, using the lived experience as a propulsion to move us forward in community-based research and to promote the collaborative learning through regular meetings, knowledge exchange, bidirectional communications, and resource sharing.
Thank you, Donnie and Adelaide, and thank you for your hard work leading the COP. It's been a great experience working with you both and hearing your lived experiences and how that impacts the work that you do. So thank you. So today's webinar will feature two SEAL teams and then CEACR. So we will start with the STRIVE study, which is part of our Maternal Health Community Implementation Program, or MH-CIP. We will have two presenters there. We will have Miss Mary Schultheis, who is founder and CEO of Crescent City Family Services, and is a CBO partner for Tulane University's MH-CIP Tulane team, which is led by Kirsten Dorans. We will also hear from Colorado CEAL, and our colleagues there are Charlene Ortiz, who is the community engagement lead, and Mahad, Darah, who is the community connector lead for rural East African communities supporting Colorado CEAL. Then we'll hear from Charisse Iglesias, who is with our Community Engagement Alliance Consultative Resource, or CEACR, who will walk us through the dissemination toolkit. And lastly, we'll hear from me, Busola Saka, and I serve as the Communications Technical Assistance Lead on the CETAC team. So I will now turn it over to Mary and Kirsten to talk about the STRIVE study.
Good afternoon, everyone. I'm on New Orleans time, so I know some of you may be an hour ahead. We're probably an hour behind. So first of all, I want to thank you all for inviting us here today to talk about the strategies for implementing a postpartum lifestyle intervention in WIC. My name is Mary Schultheis. I'm honored to present alongside Dr. Kirsten Dorans. This project has just been amazing. So as we move to the next slide, my goal today is to definitely make sure that we align with what CEAL CBO aim and goals are. And so I know strengthening partnerships is something, a passion of mine, to strengthen community engagement, and always knowing that if you build those strong partnerships and those strengthen that collaboration with partners, it is the key to your sustainability. And Crescent City Family Services is living proof of that. So with the Diabetes Prevention Project, it is a year-long lifestyle intervention promoting healthy eating, physical activity, and weight loss. My goal is to really look at each slide and explain the slide so that, you know, as we get to the end for questions, you'll be able to, I can answer some of the questions. So our community-based academic partnership is testing strategies for implementing the DPP and WIC programs in Southern and Central Louisiana for postpartum women with a history of gestational diabetes or a BMI that is greater than 30. So as you look at the state of Louisiana, you can see where we implemented the project. So from regions 1 through 6 and region 9. In this implementation, we did focus on rural communities, which we know is very important to make sure we reach those rural communities, and then urban communities. So in 7 and 8, you know, some of those communities, our goal was to continue to reach families in those areas. But if we didn't implement in those spaces, it's not because we didn't. Sometimes in those communities, it's a little difficult to identify staff to really implement the intervention. But please know, we love region 7 and 8. We got some amazing WIC service providers in region 7 and 8, and they know that we have reached out to them to support them if they want to implement the intervention. Next slide. So about our community academic partnership. So the partnership is with Louisiana WIC and a host of community partners. So you will see at the state of Louisiana, when this project was implemented, it received the blessing of the state. It was easy to navigate to the state because Crescent City Family Services, we are a WIC service provider and have had many participated in other academic research projects. So to get with the intervention was to reach the state. And so Celia Bridgeport, she's listed here, and Celia has just been amazing in supporting us. So even when it came down to like IRBs and different things that we all know that need to be put in place, we had that support so that she could help us facilitate things. And she's still with us today and supporting us. And I'll explain some other ways that she's been able to support us. So we also have Courtney Martin. No pictures of everybody, but I'm gonna give you a visual. But Courtney is the director of Crescent City Family Services, and Courtney leads the Community Advisory Committee. And so I made myself some notes, but the Community Advisory Committee is our stakeholders. They are community partners in our community, and it's a host of them. So we have federally qualified health centers, we have healthcare systems, we also have the Louisiana health insurance plans. Healthy Start. Everybody on this call should know about Healthy Start. There are 4 Healthy Start initiatives in Louisiana that are community-based. We also have nonprofits like Clover, which is Early Head Start partners. We have academic partners that we also bring to the table. Our HBCUs, which is really good to have them at the table. And so what we've been able to do, Courtney is able to lead this group, and they helped us shape the intervention. So that really worked out well for us, and having Courtney lead the community advisory board. So we also have a mom's advisory board. So as you're looking at this screen, you will see the logo of Strive. Courtney led the moms, lifting up the moms' voices, hearing what the moms wanted in the program, what were their challenges, what are things that they would face if they participated in the intervention. So they designed the logo. They designed the color of the logo. So I think Dr. Dorans is on the call, and I think she may even have the t-shirt on that actually shows a t-shirt that was designed for the moms. So giving those moms that swag to make them really feel included in lifting up their voices was very key. PIs, the PIs, this is the part I love the most. I've enjoyed working close side Dr. Dorans and Dr. Jean-He. It's just great to see my name, in the list with them as a community-based organization, y'all. That speaks volumes for me as the president, CEO, founder of Crescent City Family Services, to have this partnership, this academic partnership that my name got to be listed as a co-PI and be able to lift up my voice and give my ideas, because I do think out of the box. If anybody knows Mary, I'm all over the place, but it's fun, and they can take what from a CBO perspective, and they can shape it and move it forward in a way that researchers will love that. So as you can see, the cluster randomized trial was put into 38 WIC clinics about regions 1 through 6 and 9, which has just been great to have that reach across the state. And so as we move to the next slide, I'll talk a little bit more about some of those core recruitment strategies. So having the support of the Louisiana WIC program, they have a mass text system. So we were able to, part of recruitment was to reach every mom that potentially could be eligible that was postpartum. And then the Strive team, they built a very strong team and that could get out there and do those follow-up calls, which was very key. And Dr. Dorans and her team has done amazing in being able to pull together a great team to follow up, because we know follow-up is real important when someone reaches out and they don't get that follow-up. And because we are a trusted partner and our clients know us and trust us in WIC, they're going to call and say, hey, Ms. Mary, I applied for this program, but I haven't heard from someone. But that relationship and that partnership with Tulane Strive they broke that barrier. So the text messages includes like surveys, and then clicking it to their website so that when they get the survey, it actually goes to a team member. So that's been great. Listed as additional strategies, WIC staff referrals. That's probably the best. The clients that come to WIC, we all know, trust you. We've been a WIC service provider in Louisiana for over 17 years and have served moms. And now in 17 years, we're now starting to see the babies that we serve. Some of them are now having babies. So that the families trust you and they will continue with their services. So those WIC staff referrals have just been amazing. Tabling at community events and WIC outreach events. So some of those events we know could be baby showers. So you're going to get those prenatal moms. So we were able to say, hey, you know what? The intervention is for postpartum, but if we can catch a mom during her pregnancy, and they may be on the next slide, we have the potential of reaching that mom postpartum. So baby showers, diaper distribution. If any of you ever follow Crescent City's Facebook page or Instagram page, I'll share those with you. But the key to that was, if we bring them into like diaper banks, we know that those moms are postpartum, right? They're picking up diapers. Some are picking up during their pregnancy. If we bring them into like food pantries, So using the food pantries, using those avenues that we could use. And we know those community clinic, those other CBOs like Healthy Start, there's 4 in the state of Louisiana, they serve the WIC population. We know that the health plans serve the population. We know that our FQHCs serve the population that are going to WIC, because some of our FQHCs also have WIC offices. So they're embedded into the office, and we have a couple of them of our Healthy Start projects that actually have WIC offices. So that's been really good to be able to have that. So next slide. So the next slide, we'll talk about some of the recruitment challenges. When we started, it definitely started out slower than expected. We have to know that during the time there was some WIC operations. WIC was remote, and so some of that getting back in-house and really getting our back into our bearings of the facility was some challenges early on. Meeting with partners to address those recruitment challenges was a key success because they were able to share and let us know a lot. Dr. Dorans has just done an amazing job. She always prepared me for these meetings so that when I went in, I could support her, but we knew what we needed to get from the community to lift up those CEOs and lift up the voices of everybody who we brought to the advisory was very key. So I know about March. In March, we did a meeting with some partners where we actually did a retreat. So, and I think we had members from the West Stat team actually came into New Orleans. We sat at this beautiful conference table, y'all. I just love that table. And, you know, like you say, bringing it to the table, setting the table, that was the key, how we can sit at the table, come to the table and address these concerns. So about June, when we had some CEACR consultants come in about June of 2025 and was able to meet with 6 Louisiana WIC clinic staff. So hearing the voices of the WIC staff was even more important because they do the day-to-day operations. How can you support the intervention without impacting you in the work that you do every day on a day-to-day basis? Because everybody's, like I say in WIC, we got the my plate, everybody's plate is full. And so just making sure that things were portioned out, broken out, and positioned where we still can get that nice, healthy outcome of this intervention integrated with WIC. So I will say this, it was definitely a perfect match. I will use perfect match in the past because I have to share that Crescent City Family Services, we were also a Healthy Start grantee, and we know when you bring these interventions in, you will get the results that you need. So our intervention, we were able to drop infant mortality in Jefferson Parish from 12.8% to 6.3%. And so sustainability lies within community engagement and community partners. So in response to the specific ideas and the feedback from partners, CEACR, WIC, Strive, and other collaborating partners, we were able to take those strategies of recruitment, and guess what came out of it, which included the creation of some amazing videos. So next slide. So the videos, that what we decided to do was adapt some recruitment strategies. So one was to increase the potential eligible participants. So what we did, we went to monthly texts into the clinics, expanded it to pregnant women, as I mentioned early on. Let's get those pregnant women now, because if they've got gestational diabetes, this, you know, you can come in. And then if the expanding it even with the BMI being greater than 30, that was something we see many of our moms coming in, and we need to address those concerns. So doing some mail out postcards were important. Collaborating with the WIC staff to increase referrals was amazing. Those lunch and learns, and if you ever travel Louisiana, there's flavor all over Louisiana. Central Louisiana got some good food, you know, down in Louisiana, New Orleans, and just all over regions 1 through 6. I'm like, y'all, I'm ready for the potluck. So it's been so fun doing the lunch and learns, not only going to do the lunch and learn and tell about the Strive intervention, but integrating and telling about how good work you're doing to keep WIC strong for 50 years. WIC has been around for 50 years. We're still one of the programs that can still reach out and touch families, hold their babies, see their faces. And so I'm proud of that. Being able to get the monthly newsletters out and those referral information was key. So some other great things that Dr. Dorans did to support the staff, she created a FAQ one-pager. Give them some good reference guides, stuff that if you can just put in our mom's hands, if you're at an outreach event, if you're doing a baby shower, you're doing something, things that if they had questions, those questions could be answered. So recognition was key. Nice certificate. in the newsletter, what I liked about the newsletter, if you met those recruitment goals, your name showed up. I'm proud to say Crescent City's name showed up because we're going to show up and show out. So, and that makes me feel good as a CEO because then I can, always thanking my staff. That's one thing I do every day when they come and they leave. Good morning and thank you. So that frame certificate was very key to be able to share and present to the offices. So next slide. So the creation of the recruitment videos, YouTube channel, y'all, was just amazing. That's why I said in 2025 at our facility, Crescent City Family Services, we hosted the production company to come into our space. We've kept that space wide open for great opportunities. We've had 60 minutes actually filming our space. So we brought some nice people to come in and film, but this one was my favorite because it, the highlight, and I will explain the pictures here. It featured WIC, Strive team members, a world-renowned to me, OBGYN, Dr. Veronica Gillespie. She is known on if you don't know her, you need to look local, state and a national level. She is amazing. So please, y'all, she's doing some amazing work. So look up Dr. Veronica Gillespie. But also the dissemination was key. To me, dissemination is the key to anything you do. That if you don't hold things close to your heart, let's get this out and make sure that we can reach the community. They know the outcomes, they know who we're partnering with. So we added it to our website. We actually added it to our website at Crescent City Family Services. We put it on our social media platforms and it's actually out there. And the return on it, Dr. Dorans will speak a little bit more about that, but the return was amazing. So at the bottom of the screen, you will see two moms who were participants. That touched my heart so much to hear the moms speak about it. It was nothing rehearsed. It was not planned. They didn't know what they were going to be asked. We just told them to come in and be you and lift up your voices to share what you share. And these moms not only spoke about how the intervention impacted their lives, but they also talked about how it impacted their family's life. So it changed. They talked about how many pounds, weight they lost. They talked about things. And then they talked about the friendships that they developed by coming to the intervention and meeting other moms and being in the space with moms, their children getting, when they bring the kids, being able to accommodate the children getting to meet new friends. So it really has created a very good intervention and the impact on the lives of our family. Dr. Gillespie did an amazing job in her videos, and she's so natural. So she was able to, on that day, do the video for the Strive team, and then also speak a little bit more on another intervention that we were working on with the Hear Her campaign. So that's been nice to have her because she is definitely a voice to be listened to and to be heard. And so the Tulane Strive team, they were amazing in being able to, be present and share the intervention, give some good information about the intervention. And so on those videos, you'll be able to see a little bit more about how the Strive team and Dr. Dorans and all, they really did an amazing job. And I'm very grateful that they selected Crescent City Family Services as the location to do the video. So it's been good. So next slide. Okay, and I think this is where Dr. Dorans comes in, and I definitely want to thank you all for giving me this opportunity to share my passion for being a community partner, a CBO that is very involved, and that involvement is because of Dr. Dorans and the Tulane Strive team. So I'm very grateful and honored. So thank you.
Sorry, it was muted. Thank you so much, Mary. That was so wonderful. And I really wanted to reiterate all the support that we have from Mary, and especially for those videos. She knew the group to film them and brought in Dr. Gillespie Bell, and so really made it possible within her clinic. So I'm just going to talk very briefly about some of the reach of the videos and how we disseminated them. So we created a YouTube channel in November of last year to house those recruitment videos. We posted them there, and you can, I can drop in later, or someone can drop in a link to our YouTube website as well, or our channel, sorry. And so we paid for a few months this year from January to March of 2026 for YouTube and Google ads. We also had support from Mary and others with posting the videos on social media, like on Instagram and Facebook, which helped us reach more people. And through all of that, the YouTube recruitment videos received almost 2,500 views last year in 2025, and then almost 44,000 views as of late May in 2026. We've been able to reach the demographics as well from the data from from YouTube and Google that we've pulled. So about a little bit more than 80% of the viewers have been from Louisiana. And then almost 60% of the viewers are female. 20% of those who are engaged views, so like have, I think, watched to a certain amount. 20% were ages 18 to 24, 42% ages 25 to 35. So you can see that the demographics of those that are watching and engaging align with the demographics of postpartum moms in Louisiana. And then in terms of our impact on recruitment, there were, as of late May, 46 people who filled out an interest survey that had said that they heard about Strive through social media and online ad or YouTube videos. So we think, likely linked in with these videos and their dissemination. Next slide, please. In terms of our lessons learned, as Mary mentioned, having the videos feature members of the community, members of the Strive team, also Dr. Gillespie Bell, and past participants of Strive really gave the study and the videos more credibility. We got a lot of positive feedback about them. The Strive website was also ready and up to date, ready to accommodate signups that might have come out of people watching the videos or learning about Strive through any of those other means like flyers or emails that we talked about. The videos did have high engagement and they reached that intended audience. Though the videos didn't result in a very high number of completed interest surveys, they do serve as a lasting resource about the program going forward. And so that wraps up our presentation. On this very last slide, we just have a few more QR codes. Oh, I'm sorry, if you don't mind going to the next slide. Yeah, we want to thank you so much. We have a QR code on the bottom left for the website, the middle for the Strive YouTube channel, and then on the right-hand side, it just links directly to the main promotional video as well that we screenshotted in a couple earlier slides. So really wanted to thank you all again, and a giant thank you to Mary too, and for the opportunity to present. Thanks.
Thank you, Dr. Dorans.
Wow, thank you both so much. I will now turn it over to Mahad and Charlene from Colorado CEAL.
Well, thank you. I'm going to go first. So my name is Charlene Barrientos Ortiz, and I am the community engagement lead for the CO-CEAL project. But I will say, I'm just going to do the introduction and kind of, share a little bit about our project, but then I'm going to hand it over to Mahad. And I will share with you that I hear that one of the aims here for this meeting is to really talk about how research partners incorporate community. I will say we're a little bit different. We pay attention to how community involves us in their everyday life. So we're the Colorado Community Engagement Alliance, affectionately known as CO-CEAL. And our overview is this. We work throughout Colorado, and we're a partnership between the University of Colorado Anschutz Medical Campus, which is in the Denver metro area. We do have community-based organizations that we work with, but really more, we work with trusted local community members. Our reach is much deeper and stronger as we work with local community members. But we do work with community-based organizations, but our frontline and our partnerships are really with community members. And when we say local, I'll introduce you at the bottom, different communities. So our mission is really to address disproportionate impacts on health through active community engagement. And while this is a community engagement project, we often use community-based participatory research principles as part of being, not necessarily laid out like here are the principles and we follow them, but we are being that together. So we believe in capacity building, both on the research end, but more to the community and our community partners, our community connectors, and folks interested that we work with. And so we have a long-standing community partnership to improve participation in health research. I will also say that we welcome new folks, and I'm excited to be here because I get to see Mahad. He's one of our community partners, but you'll hear about how they led us into their world. So we're currently working with 5 urban and rural communities across Colorado to address local health concerns. Each of the communities decide what that health concern is and how they want to approach it. So our partnering communities are the rural Latinos and Hispanic communities in the South San Luis Valley, which is at the bottom, you know, it's really, I mean, for all intents purposes, it used to be New Mexico. So it's even having that kind of flavor, right? And then we work with the urban American Indian, Alaska Native communities in the Denver metro and Boulder communities. They're about less than 3% of the population, but however, we treat them as if they were all of the population in Denver. We also work with the Latinos, and Hispanic communities in the Metro Denver area, which is 5 different counties, and the Pueblo community. And then urban African American and Black communities in the Denver metro area. And then we're highlighting the rural East African communities in Fort Morgan and Greeley, which they're considered rural, but Mahad will talk a little bit about that. What I want to really share with you is that while all of these communities are different, one of the things that there's a common thread is they're passionate about the community. They have their own ideas. My role is always to ask for more money than we have, but you know, I always tell them all they could do is say no. But we have fabulous PIs. Dr. Dawn Neese is the academic PI, and our community PI is Dr. Ricardo Gonzalez. And so they hear that from all of that. And again, we come from the place and space. How can we be a part of the work that you're already doing? And that this is combined funding so that we can all work together. So next slide, please. I'm just going to introduce this really quickly, and then I'm going to turn it over to Mahad. And so we did the Common Survey 3, like many folks across CEACR did, and we really talked about data and dissemination. And there may be a picture in here, but we really talked about like what is academic, and we know we have more than one audience, but what is the text, right? What is this? What does it look like, and how do we want people to learn about the work that and the representation and the voice through data? And then communities, including Mahad, knocked back on the door and said, yeah, that's good for you. This is not going to work for us. So he'll talk more about what they did. So I'm going to stop there and turn it over to Mahad.
Thanks so much, Charlene. Thanks everyone that is participating with us in here today and giving me the opportunity to present with Charlene. Busola, if you want to go to the next slide. Sorry, I had it mixed between the slides. So actually, sure. This should have been after the next one. But
sure.
I think Charlene pointed out a very important point over there, and I hope everybody can hear me just clearly, is that we let communities determine what that health concern is. And that's very important. So before I talk a little bit about our engagement in this particular context of our community, and remember there are 5 communities that the CEACR is working with. We're just one of those 5, which is the East African community that resides on the eastern part of the state, which is predominantly rural area. So you have a community that came here as refugees or immigrants that have linguistic challenges, and you have a community that is not familiar with those folks or their background or where they come from, and sometimes resistant to who they are and try to, you know, some members trying to get rid of them. So the community that I work with that are from a life married with trauma, with civil wars and all of that, made their life in a community that doesn't look like them, that doesn't speak their language, that doesn't share any food or any similarities with them, with an entirely new system. So traditionally, we would have other community, other organizations that would come to us and would like, in a good fit, engage with us. And most of the time, they come with a full package. They come with the program, they come with the expert, they come with the interpreter, they come with the full program. And all they needed from us in the past was, hey, we just need 10 people, right, in a classroom, and then we got it all figured out. And, you know, being new in this country, not knowing anything, we would just agree to it. And then, but numbers would show whether that program is successful or not. And it wouldn't take long, actually, to show that. It would last about a week or two, and then it will fall apart. So the CEACR came into our community at a time that we were studying a new approach, an approach to partner with other organizations, but not in a way that they often wanted. So we were exploring if an organization, or a model, I would say, that if an organization wanted to engage with our community, we'd sit down with them and listen to them. And we would ask questions, tough questions about, hey, how do you want to carry this out? How did you determine that we actually need that? Who did you talk to? What is your... And they would always come with beautiful stories, right? With, you know, hey, we've got data from such and such database. Hey, we've got this community in that area. And things will actually fall apart when we ask very relevant, specific questions of how much they know our particular community. And they were like, oh, yeah. And then that's when we push back a little bit and say, hey, how about this? How about we sit down with the expert and have one of our English-speaking members talk to that expert, listen to them, and determine if what they have is actually relevant for our community. And if it is, good. If it's not, then give us the tools we need to go back into our community, interview them, or do our own research, and then come back with something that would actually fulfill maybe the same goals or something completely different that you decide if you were going to work with us on. And that was the first step. And it would always not look easy, right? You have a strong academic folks that have very strong opinions. There's no, this is how I know things are done and this is how it should do. And then for the very few that like to go with us, we would then go to a second step and say that instead of relying on an interpreter and bringing an expert, why don't we have that expert train community members, folks from the community, and give them all the materials they need, and then decide in a way that they teach those materials to their community in a way that's culturally relevant. So you can imagine how someone with a strong academic background would actually panic when we talk about that. We're, oh, no. And then they would throw like 1 million questions. And then we'll always have responses to those questions, but it's a matter of whether they consider our responses as academically relevant or fitting the model or the approach that they came with and stuff like that. But eventually it would be such a pull and push in negotiations. So CEACR came into our community in that particular juncture. And they came in with a mentality that, hey, yeah, here, you know, is what we have. See if it fits into your community and then determine whether that's relevant in your community or not. I mean, there hasn't been zero challenges. Of course, there's been challenges with that particular approach itself to begin with in the beginning, but CEACR has provided us the time and the space to be able to negotiate that, to be able to present our case, particularly Charlene. Charlene actually sort of raises me all the time. I was saying, you know, in our last week brief introductory meeting, I don't know how to respond to that sometimes. You know, I feel like maybe closing my camera or something, but, you know, a lot of the praise is due to her actually, with the connection that she has provided and the advocacy she did. So it's always been where our community decides what that health concern is and then go back and the engagers, community connectors, participants, people that decide material production and disseminations are all from the community. So we've at least achieved that with this particular program, where at least maybe I would say 95% ownership, the program stays in the community, with delivered in a language that is relevant to them and that they understand. So that's a significant shift of the model, the traditional way of outside community used to engage with our East African communities. And then with that came, this is only, so what I'm talking about today is only one particular set of engagement. There's been, in the Common Survey 3, a lot, I think about 200 people have been interviewed, divided into 2 downs. And then there's been a lot of data that has been produced. And then it was for us to sit down and find ways to explain that complex data in a way that the common community member of us understands. And with that, we came in with infographics, we came in with the video. So those are the 2 particular tools that we have used that the community has actually decided would be the best way to explain the key findings of that data in a way that not only the community understands, but also in a way that can easily be disseminated and shared with the maximum number of community members. So we use WhatsApp, I think, in the subsequent, or maybe Busola, if you want to go back to that, to the one before. Yes, thank you so much. So this is some of the work. We found a way to explain some of the basic things or some of the key findings of the data that we have collected. It's, I think this is a combination of 6 different infographics, but each graph, you notice that we try to keep the writing and the content in there to the minimum. I mean, this one where it says our community, our numbers, our story is a combination of the 6. But each one of the others, we try to keep it visual minimum. And this is only the English version. There's also a Somali language version. So our folks in the East African community, if you hand them a piece of paper that has more than 3 paragraphs of writing, they're probably not going to read it. They'll just toss it away and then move on. So with that, we try to keep it at a minimum in a way that can, catch people's eyes, have them find out or, know what they need in that particular moment within, 10 to 30 seconds. And then probably if they find that interesting, continue to read it and engage with the rest. So this is only this is one part. There's also a video part where people are able to listen and also in that listening session, able to view different elements, explaining pretty much the same thing that we have presented in here right now. So our best means of communication with the community is WhatsApp, right? A lot of, the average community member has 90 to 95% of their family members back outside the US, wherever they come from, right? And the best means of communication that we have in our community is WhatsApp. And we leaned on WhatsApp. So WhatsApp has provided us as a platform where we are able to communicate, create group chats, and share information over there, while also trying to keep it at a minimum, right? People get excited sometimes, and we try to discourage them from using this group chat as a dumping place where if they see something that they find it interesting in social media, they will just copy the link and then dump it in there. And that's really very easy to do it in WhatsApp groups for those who use it. We make few exceptions to share some greetings and well wishes for occasions like Eid occasions and holidays and festivities. That has been our preferred means of communication. So there is one cultural nuance that an outside agency would probably not understand, but in a community like ours, people don't like to be on camera, right? They will, in some meetings, we even discourage our partners not to appear that they are aggressively taking notes when they're talking to people. We tell them, don't look that you're actually recording someone's entire life by taking like frantic notes in a way that would actually trigger folks. I don't know what that has to do. Maybe it has to do with the previous trauma, with the mistrust in the past. And I myself have that phobia of being in a camera and actually being recorded and stuff like that. But I was able to ease myself into it over time. So respecting that, and we always offer our community members, if they wanted to contribute any of the production materials, for example, they wanted to be in a video, would like to have their voice recorded in there. A lot of them said, no, we don't, and we didn't want to push that. So we relied on AI generated. So in an age of AI, it came at the right time, I believe, and then we rely on a way that we produce the material in a frame by frame with the editing, of course, with the technical editing involved in there, making sure that the content of that video is accurate. But we had a voiceover. It comes in two languages. One is in English, also AI generated, but also there is a Somali video that has a Somali voiceover that is recorded by a member of the community without showing their face. So we have that available option. That's the participation that some members of our community were happy and comfortable with, and we're happy to accommodate that. Like I said, sharing this is the best tool that we have via WhatsApp. There are other parallel courses that are going, and yep, thank you, Busola, for sharing that. So the partnership is actually equal. We co-create our contents with CEACR. Materials are built, focusing or having in mind, do the community understand this? Rather than just checking a box, or maybe this is what the approach or the model demands, let's just try to fit that in there. There's a lot of negotiation involved in our roles with CEACR, and as much of a difficulty that has been to some people in the past, I think now we are at a level 5 years now that where it's comfortable. Like if we push back on a lot of things, which we do most of the time, there is at least a platform that is provided to us to negotiate that and actually have our voices heard. And it 99% of the time works in the way that the community wants, and we're very grateful for that. So like I said, the means that we use in a way that the surveys and the stories that it reflects is understandable through the videos and the infographics that I have shared. I want to talk about Busola. Do I have time to continue talking, or is it?
We have 2 more presentations, so maybe
Cool.
a minute.
Okay, perfect. So I want to talk about the way that our community has evolved when it comes to dissemination. So in the past, I think the go-to means is, oh yeah, let's just create a flyer about this information and have it, put up somewhere, or let's maybe create a video or a picture. All of those are actually useful. It's things that we have used. But in other parallel programs, also with the CEACR and bootcamp translation, recently folks have raised the concern that the utility of those materials are timed. So how long can you hold on to a flyer, right? Eventually you're going to throw it away, or maybe it's going to get damaged and throw it away. So they have decided to combine all those documents in a platform that can actually be used and accessed forever, right? And we have created an app, a BWA app that people can have in their phone that we can store all the materials from BCT, and we're also intend to have those data outcome from the survey 3 and the next one's also in there in close collaboration with the sponsors. So that's it can tell how the community has evolved. It's not only something that you have in your phone, but it's also something that you can access it, and you can go back into previous materials and engage or read or maybe watch if you wish so. So I will end at that. Thank you, Busola, for that extra minute, and thanks so much again for having me.
Thank you so much, Mahad and Charlene. I will now turn it over to Charisse to talk about the CEACR Dissemination Toolkit.
Yeah, hi everyone. Thanks for inviting me. This is my first time at this meeting, so it was really inspiring to hear all these stories. We don't have much time, so I will try to fly through this as well as I can. Well, my name is Charisse Iglesias. I'm the Training and Resource Director at Community Campus Partnerships for Health, and I also support their CEACR project in curriculum, content, and resource development. So a little bit about CEACR, the Community Engagement Alliance. Consultative resource. We're a really cool research partnership between Pitt and CCPH, University of Pittsburgh, and Community Campus Partnerships for Health. I like to think of us as a type of like a resource hub for CEAL, where we share appropriate and contextualized community engaged practices with research teams and community-based orgs seeking to improve health outcomes. We do that by providing tailored consultations and public-facing resources for those seeking to apply community-engaged principles to their public health and medical research. And today we will showcase one of our public-facing resources, the Dissemination Toolkit. Next slide, please. So I'm not going to go through the origin story of the Dissemination Toolkit, but to the right of this slide, there's a screenshot of the Recover Dissemination Toolkit cover page. And basically, CETAC converted this dissemination toolkit, which came from a series of workshops directed toward long COVID writing teams consisting of long COVID patients, caregivers, and investigators and research staff who were writing publications together. And so it created the dissemination toolkit, which CETAC converted into the CEAL version. And I want to emphasize, why a dissemination toolkit may be important, right? As we know, within the ecosystem of community engaged research partnerships, oftentimes dissemination is often undervalued, right? And sometimes set aside as the last thing to do in a partnership. But this resource, something that centers dissemination, it puts dissemination front and center in the research partnership, which can be useful for, if you're in a writing team, a cross-sector writing team, this dissemination toolkit can be helpful to getting you to deal with different dynamics of a cross-sector writing team. It can be useful for developing, a data storytelling plan for your project. It can be useful for sharing findings with multiple audiences, but also at the same time, it can be useful for helping you understand why certain dissemination products are perceived differently based on different audiences. I feel like that's a strength of this toolkit as well. And this toolkit can be useful for translating why your research is important to funders. Next slide, please. So to the right of this slide are screenshots of 3 modules of the CEAL version of the dissemination toolkit. I just want to emphasize that, key goal of CETAC communications is to provide technical assistance to support CEAL's team's abilities to disseminate their findings, which essentially brings back the learnings to the communities that help develop them, which is why we created this dissemination toolkit for CEAL teams. Next slide, please. To the right of this slide is the dedicated web page that describes how to use the toolkit, what it does, as well as snapshots of each module and its intended audiences within a writing team. So say a certain module may be for a writing team lead, or maybe a module is specifically written for community partners or academic partners. It can be helpful from the very beginning for audiences to know which module is intended for them right at the very beginning. And I like to think of this toolkit as a sort of choose your own adventure type of toolkit where, y'all have resources, guides, reflection questions, and recommendations that can be implemented in CEAL working group meetings. Next slide, please. So to the right of this slide is a photo of people with laptops talking to each other. And these are the names of each module. These stages are really based on a general understanding of what goes on in a writing timeline. They are in no particular order because, each writing team will have to decide, how they value, what their priorities are. So identifying the format may come after selecting the venue, right? For example, next slide, please. And CEACR is always trying to disseminate resources that may be helpful for SEAL teams. And these are two additional examples of resources that reflect community engaged research priorities and principles. To the left of the slide are two photos. The top photo is two people holding each other. The bottom photo is two people looking and thinking about something on a tablet. So the first resource is Wise Practices for Outreach Messaging and Engagement with American Indian, Alaskan Native, AIAN communities. This resource provides research teams with tools to support respectful and appropriate engagement and intentional partnerships with AIAN communities. And the second resource is Community Engagement in Research, Precision Outreach and Planning, the CERPOP tools, which helps research teams customize their outreach strategy based on their community's needs and preferences. And next slide, please. Thank you for your time, and please connect with us. At the bottom are two QR codes. The one on the left goes to our consult request form to have CEACR support your community engaged research projects, and the QR to the right bottom goes to our expert panel interest form. We're always trying to expand our pool of experts to make sure our recommendations to research teams are more relevant and incorporate a variety of perspectives. And, again, thank you for your time and attention, and I'll pass it to Busola.
Thank you so much. You went through that really quickly, but still efficiently. So thank you. And in our last few minutes, I just want to talk about CETAC's communications technical assistance. It is a task that we lead here at CETAC, where we develop resources and communications trainings for research teams and CBOs to be able to communicate their research to the communities for the communities. Our topics address key communications needs that are commonly encountered by research teams. We create tools to promote clear and consistent communication. Our our TA is in modules, and they focus on topics like translating complex info into easy to understand messaging, developing communication plans for diverse audiences, and just developing effective resources in general. We currently have 4 modules available on our YouTube channel, and there will be a QR code coming up where you can scan to watch them. They are free. You can watch them anytime you like. They are available. One of them is about social media, using social media for community engaged research. One is about earned media, so how to share your work with journalists. Another one is about it gives 10 tips to help researchers and partners promote their findings. And our latest one is resource development essentials. So picking the right tool to share your message. So is it a fact sheet? Is it an infographic? Is it a one-pager? Is it a toolkit? That module will walk you through what you are trying to promote and which tool works best for that promotion. We have some upcoming TA trainings. We have one about website basics. I know Kirsten and Mary talked about the importance of an updated website when you are recruiting folks for research. And so we have one coming up about just basics for a simple website. And we have another one of these webinars coming up on community-focused social media. So our website for these trainings is at NIHCEAL.org/trainings. So NIHCEAL.org/trainings. And you can keep up with us, sign up for our newsletter that goes out bi-weekly. We have the research roundup that compiles all of SEAL's published research. So please sign up for that. Our website, we're on LinkedIn and we're on YouTube. We have done you a favor and put all these links into one QR code and link tree. So if you scan this QR code to the right, it'll take you to our link tree that has all the information that you need. I want to say thank you so much for your time today. A huge thank you to our presenters. You just have been wonderful to work with and have shared really, really helpful information. And I particularly appreciate the obvious partnership and collaboration that's happening with these teams. It's very obvious. It radiates from the screen. So we really appreciate you sharing your work with us.